Penny and her husband were my last patients for the day. Penny was this amazing preschool teacher, and she had this passion for taking care of autistic children. Her only concern around having surgery was how long was she going to be out of the classroom and how long would it take to get back to those kids. We were all hopeful surgery would go well. We'd get her right back to the classroom where she belonged. Her day of surgery came, her operation went well, and she went to the floor. Later that night, though, she had a couple problems. And by morning, it was evident that something was very wrong. I rushed Penny back to the operating room, and in the operating room, I found that Penny had a hole in her colon. She was very sick. We washed her out, we closed the hole, took her back to the ICU. She's now on a ventilator, she's on medicine to keep her blood pressure up, and I went to explain to her husband what we found. I told him we found a hole in her intestine. It was the result of a mistake that I had made, a surgical error. She was now very sick, but I was hopeful she was going to survive. Throughout the day, unfortunately, though, Penny got progressively worse. By evening time, she was now on high doses of numerous medications to keep her blood pressure up. I went to the ICU late that night, and I stood at the foot of her bed. I watched her laying there, barely hanging on to life. I was trying to replay the operation in my head, trying to figure out where I'd made my mistake, when I realized that her husband was sitting off in the corner in the dark. He got up, he came and he stood next to me, and we both watched his wife lying in bed, tubes and machines everywhere, keeping her alive. I held it together long enough to tell him, I don't know if she's going to survive this. I am so sorry. I didn't know how he'd react. I didn't know if he would yell at me. I didn't know if he would call me names, but he didn't. He put his hand on my shoulder and he said to me, "It's okay. I know you did your best." Are you kidding me? It's okay? I know you did your best? I was supposed to be the one that was saving her life, but instead the mistake that I made was taking her away from him. He didn't blame me. He gave me grace. Grace that I desperately needed, but never thought that I would get. This special man had a gift to see that I was struggling, and he set his grief aside to help me. Now, this is not where we would expect to be getting support at this time. From the husband of my dying patient, we'd expect to get that help from more traditional channels, from our families, from our close friends, from maybe even our coworkers. Those people that know us best and have the best insight into our personal struggles, that's where we should get that support. Unfortunately, no one person knows us completely. No one has a complete 360-degree view of our lives, and this lack of a circumferential view creates safety gaps that put us at risk. Now, many of those gaps occur in the workplace, as many of those stressors are work-related. And as a leader, it's our responsibility to identify those gaps. This comes natural to many leaders, but all leaders should feel comfortable checking on their team members, and all team members should feel comfortable being checked on by their leaders. That's how our system works. That's how it's worked for years. But unfortunately, that system is failing, and it's failing some of our key team members. It's failing our leaders. Who's checking on our leaders? Some highly functional organizations may do that well, but most do not. And why? Well, early in my career, I had the opportunity to serve in the military, and I had the honor to care for our soldiers and their families. I'd been in the Air Force for about 2 years. I was a young major, and I had the opportunity to care for the wife of one of the highest-ranking military officers I would ever meet. Shortly after caring for her, I diagnosed her with an advanced stage of cancer. After making that diagnosis, I had a rare moment where I was with her husband alone, and I felt the need to check in on him, to see if there was anything that he needed or that I could do for him during this stressful time. Now, I don't really remember exactly what he said to me, but I certainly remember the shame that I felt by crossing that line and asking him. His message to me, do you not know who I am? Do you not see the stars on my shoulder? Do you think that I don't handle my emotions and I need your help? How dare you ask me that question? The lesson I learned from that was leaders are strong. They know how to handle their emotions. They don't need help, especially from somebody they lead. Don't check in again. Now, in the course of preparing for this talk, I had the opportunity to interview leaders from across organizations and industries. And I asked them all, during the course of your career, how often has somebody that you led reached up to check in with you? They almost all told me, almost never. One leader tells a story where during the pandemic, she had pulled her team together to talk about the struggles of living through the pandemic and the social unrest of the last year. During that meeting, she had revealed that she was struggling too. Only after she revealed that she was struggling did someone on her team reach up to check in with her. Everyone was feeling the stress, but everyone assumed that the leader was not. Now, I want to note I use the term leaders. I'm not using the term bosses, and I'm not using the term executives. This is not a problem isolated to the C-suite, and this is not a problem isolated to large corporations. This affects leaders up and down an org chart. This affects small and medium-sized businesses. This affects male and female leaders. This affects black, white, and Asian leaders. This affects leaders who have been doing this for 6 months, and those who have been doing this for 50 years. If this problem is so pervasive, why are we afraid to talk about it? Well, there's this universal perception that leaders are immune to the stress of the world. They are strong and resilient. They have their act together. They do not need to be checked on. Even if we suspect they are struggling, we do not check in. It violates our chain of command. It doesn't feel right. But we can make it right by simply checking in. Now, a few years ago, I was called in the middle of the night to take care of a young boy that had been in a severe car accident. I was in the trauma room when the child rolls in. As he rolls in, I realized he's just a couple years younger than my youngest daughter at the time. We start to resuscitate the child, placing a breathing tube, starting IVs, giving him medicine, fluids, taking x-rays. We soon realize that he really doesn't have any significant injuries other than a devastating brain injury. His brain injury is so severe that we do not expect him to be alive for more than a few hours. We take him to the ICU, and by morning, it was clearly evident that the child was brain dead. Now, to declare someone brain dead, you have to do a series of neurologic tests. And I had done this examination numerous times in adults. But I had never done this in a child. And declaring the death of a child is something that stays with you forever. Now, the only solace I had was that due to his numerous uninjured organs, this child would be an ideal organ donor. And ironically, he would now be able to save the lives of numerous children across the country and answer the prayers of their families. We had this conversation with his family. We talked through that. They agreed to proceed. And so we began the complex process of preparing for organ transplantation. That night, I received a call from the ICU nurse. And she said, the family's changed their mind, and they decided not to proceed with donation. And they wanted him taken off the ventilator immediately. And the child died shortly thereafter without donation. I respected the family's decision because I couldn't imagine the grief they were feeling. But I was personally devastated. It was hard enough to have lost the life of this little boy, but I also felt that we lost the lives of all these other children that had been waiting for a heart transplant or a lung transplant or a liver. Now, obviously, this situation was very tough on everyone involved, very emotional. So in order to make sure that my team was able to talk through their grief and grieve safely, we brought in our critical incident stress management team to help them through that process. A couple days later, I passed the lead counselor in our hallway at the hospital, and I asked her, I said, how's everyone doing? Is there anything that we need to do for them? And she thought that the team was doing okay and they would be all right and not need any more help. And then she said, no one's probably asked, but how are you? I explained it was tough. It was kind of an emotional thing for me, but I was doing okay. When I realized now that I had tears rolling down my face. Clearly, my words and my emotions did not match. and all she had done was check in. No one had checked in with me, right? But I don't need to be checked in on, right? I'm a trauma surgeon. I see death all the time. I'm a chief medical officer. I'm former military. I have my act together, and these things don't bother me. Well, maybe not. Fortunately, this team member took a risk in reaching out to ask me. She didn't know how I'd react. Would I laugh and belittle her concern? Would I get angry with her for suggesting that I couldn't do my job? Or would I show unexpected emotion in a hallway and she find herself now talking me through my grief as people are walking by? I was fortunate that she was able to reach out and ask, because many are not so fortunate. Prior to COVID, the highest incidence of suicide is among physicians. 300 physicians a year take their own lives. The incidence of depressive symptoms is 3 times higher since the onset of the pandemic in adults than it was prior, and the incidence of severe depression is 7 times higher. Since the onset of the pandemic in March, leaders have been fighting to keep businesses open, lights on, and employees paid. And despite that, we've asked them to step it up numerous times. As we exited the first surge, we re-engaged. As we prepared our COVID exit strategy, we had to step it up again. And then a second surge, and we stepped it up again. And now as we're leaving COVID, we're asking them to step it up a last time. Our leaders are exhausted, they are stressed, they are out of gas. With our leaders and subsequently our teams at greatest risk now, how do we support them best? How do we create the environment where they are supported from above and below? Where we create that culture where we can ask questions, professional or personal, of each other and of our leaders. Sometimes this is an organizational culture where we do not draw hard lines in our hierarchical structure. But many times this is not an organizational culture, but it's a personal quality. Am I able to be an effective leader and an empathetic coworker that encourages my team members to be able to ask questions of me and to check in with me as the leader? Absolutely. And I think those are some of our most effective leaders. If we just check in, does it have to be an emotional, soul-emptying conversation in a hallway? It doesn't. If we just check in, does it have to be a prolonged counseling session? It doesn't. Can it be? Yeah, it may be. If we just check in, it may just be a, I'm good. I so appreciate you checking in. Thank you. The most important part is just checking in. The mere act of checking in is incredibly powerful for both people. For the team member, it's empowering as they reach out of their comfort zone to check in on somebody they wouldn't normally be checking in on. And for the leader to know that their team is concerned about their personal well-being is not only comforting, but reassuring, knowing that they are there to support them. This sense of caring, both up and down, is what solidifies teams. Checking in initially, though, is uncomfortable. It's backwards. It doesn't feel right. But with time, it gets easier. And maybe with time, it doesn't feel so weird. Maybe ultimately, it becomes the norm. And maybe it bleeds out of the workplace to a place where we feel comfortable checking in with somebody that we wouldn't normally be checking in on. A neighbor, an old friend, maybe even a total stranger. Somebody that may be struggling, and they need to be checked on, and they need to know that we care. Not the passing, how you doing, but an intentional. How are you doing? With the empathetic intent and commitment to be there if their answer is, I am not good. Now, I never finished the story about Penny. By morning, Penny had stabilized a bit, and over the next few days, she got better. 3 weeks later, she left the hospital. And 3 months later, she returned back to the preschool where she worked before. I had taken care of Penny, seen her numerous times during her recovery. And about a year later, shortly after Christmas, she returned to my office. I went in to see her, and she had this huge gift and a card for me. I opened the card up, and the card was written by her and her family, explaining to me how thankful they were for me. I opened the gift, and the gift was this custom-made picture they had made for me. I think they thought it was something cute that I would hang on my shelf in my office. I don't think they understood the significance that this would have for me. So this picture now hangs on the wall in my office, and it serves for me as a daily reminder of the significance of the work that I get to do each day, of a day that I was given grace, and the impact that we can make by simply checking in on each other. In the words of C.S. Lewis, to save a man, all it takes is to take a step, and then to take another. So I need to ask you, who do you need to check on? Thank you.